and thank you to Santen for creating this glaucoma awareness program on the behalf of the World Glaucoma Association, wherein for the last 8 or 9 years, we have been doing this awareness program through the World Glaucoma Association by celebrating a week of glaucoma awareness. And this happens to be from the 7th of March to the 13th of March this year. With this, I shall just go on to tell you more about glaucoma. So, what is glaucoma? It's a group of eye disorders which is characterized by a high intraocular pressure that damages the optic nerve. Glaucoma is one of the most leading causes of irreversible blindness in the world, and it is the leading cause of blindness amongst adults. One fourth of those affected with glaucoma in the world are actually Indians, and that's why we in India need to know a lot more and create a lot more awareness about glaucoma. So, what happens in glaucoma? The optic nerve cannot stand the stress, falls sick, and later on dies by a process which is known as apoptosis. Hence, the connection from the eye to the brain is completely lost. Since there is no connection now from the eye to the brain, whatever the messages the eye receives in form of sight are no longer transmitted to the brain, and hence you are unable to see. This is a gradual process, but the damage caused, however, is irreversible, because if any of the brain cells or any of the nervous tissue cells die, there is no way in which they can be recovered. So, a dead neural cell is dead forever. So, ensuing blindness, however, is therefore permanent. Vision lost can therefore not be regained, but whatever vision is left can definitely be retained. Now, this is what happens. If you look at this diagram, you can see that this is the eye. You get visual outputs from outside. They are all received here at the retina, which actually ultimately go and form the optic nerve. And this optic nerve then carries these messages to various parts of the brain. And it is this part of the brain, the occipital cortex, which is responsible for us seeing. Now, since the damage of glaucoma happens at this point, the optic nerve head, there is no message that passes from here on to the brain, and that is why you start seeing less. Now, if you see, this is what happens in glaucoma. This is what the optic nerve head looks like when it is very early in damage. Slowly, as the damage progresses, you can see that the cup size increases until it becomes pretty severe. And therefore, to start with, the vision is absolutely normal. There are no symptoms, and you can't really make out that there is something going wrong. Slowly, as the disease starts advancing, this is what happens to your vision. So the peripheral vision actually starts getting blurred. What you could see very clearly here is now getting blurred. And as the disease advances further, this closes in until you are left with only a tunnel vision. And in the late stages, even that is lost. And why does this happen? So we need to know a concept which is known as the intraocular pressure. Now the eye has to be transparent, especially in the visual axis, for the visual messages to be transported from the outside world to the inside. And therefore, there can be no blood vessels along the visual axis. So the path through which the rays of light travel from the outside to the inside, that entire path has to be absolutely transparent. So the cornea, which is the first layer of resistance in the eyeball, is clear. Then you have the anterior chamber, which is full of a fluid, which is known as the aqueous. Then you have the lens, which has to also remain transparent. And then you have the vitreous, which has to also remain transparent. So, but having said that, if all of these tissues are live tissues, all of these tissues require nourishment. And this nourishment is provided by nature through a fluid which is known as the aqueous humor, which is secreted in the eye itself. It is this aqueous humor that maintains the normal intraocular pressure. But aqueous has a dynamic circulation because every time new aqueous is produced, the old aqueous, which has fulfilled its job of giving nourishment to the tissues, has to be washed away. And this happens at a particular rate. So there is some amount, X amount of aqueous that is formed, Y amount of aqueous that leaves the eye, and X minus Y is the amount of aqueous that stays in the eye to give you a normal intraocular pressure. And this is important because the eye has to maintain its shape, it has to maintain its size, it has to maintain its other functions, and therefore the amount of aqueous that is formed cannot equal to the amount of aqueous that leaves the eye. There is always a difference, and it is this difference which stays in the eye to give you a normal intraocular pressure. Now, when the outflow of the aqueous decreases, this aqueous just continues to gather in the eye in the bony socket of the orbit, and therefore the intraocular pressure rises. Now, what is the intraocular pressure? It is similar to air pressure in the car or a cycle tire. In the eyes also, you have to have a right amount of intraocular pressure for safety and for performance. The normal intraocular pressure averages between 12 and 22 millimeters of mercury, and that millimeters of mercury is the scale at which the eye pressure is recorded. When the pressure raises beyond 22 millimeters, then we are at a greater risk for developing disease. If you look at this, you can see that this is how the aqueous is formed, and slowly the aqueous comes out from there and goes out from this drainage channel. However, when this drainage channel is blocked, then what happens is that the pressure starts building up in the eye, and this pressure that builds up in the eye then starts working on the back of the eye, and this is the back of the eye, which is nicely magnified to show you that this is how it looks. But when there is pressure, then this automatically falls back. Now, this fluid, which has a dynamic flow, which I already told you, is produced and drained continuously. But if it is unable to drain, then the pressure obviously falls on the optic nerve, which is lying behind, albeit this is typically painless and gradual. And therefore, as the pressure starts building up, very, very rarely the patients have any symptoms whatsoever. Especially in a variety which is known as the open angle glaucoma, the changes that happen are so slow and subtle that the patient has absolutely no symptoms. So the patient has no pain, the eyes do not become red, the eyes do not show any symptoms whatsoever, there is no headache. And so the patient doesn't really realize all that is happening in his eye. And without his realizing anything, he is slowly losing vision. So who is this person who can actually suffer from glaucoma the most? So let's look at the risk factors. So all people whose age is above 50 are likely to get glaucoma much more than the young. And this risk increases with every decade. If there is a family history of glaucoma, somebody in your house, your mother, your father, your uncles, your aunts, your grandparents, your cousins, your siblings, if any of them have glaucoma, you are at a greater chance for getting glaucoma. If you have had an intraocular surgery, so you've had a retinal detachment surgery, you had a cataract surgery, or if you have had a trauma to the eye, you've met with an accident and your eye has been injured, then you stand at a greater risk. If you've been a myope for long, if you have diabetes or systemic hypertension or blood pressure, or if you're taking systemic steroids or local steroids for long. Now, commonly, what happens is you don't even associate these steroids with glaucoma. So you could be taking steroids for a totally different reason, like maybe asthma, like maybe arthritis, like maybe some skin disease. And even more commonly, we see people who have allergic conjunctivitis who have red eyes. So they just go and get a OTC prescription for a steroid drop. They continue to use those steroids. They feel good. They stop the steroid. Again, the allergy comes on. Again, they go and replace their prescription with another steroid drop, and this goes on. And because they feel good, because the eyes are no longer red and hurting them, they use this without any discretion. And these are the people who are most likely to cause this great silent damage to their eye, and they just don't realize what damage they're doing to themselves. And then, of course, we know that the black race, the African race, is more prone to the primary open angle glaucoma, whereas the Asians are more prone to an angle closure glaucoma. So there are two types, or maybe there are three types of glaucomas that we can actually talk about. There is something known as a primary glaucoma, which could be either an open angle or a closed angle. And I don't think you really need to know very much in details about that. Then there are secondary glaucomas, which are seen following some other pathology. So you could be having some other pathology in the eye, the result of which is a raised intraocular pressure and a glaucoma. Or you could be having glaucoma at birth. So this is what is known as the congenital glaucoma, which is seen either at birth or it is seen in early childhood. What are the symptoms? Like I told you, glaucoma by far is a silent disease. There are no symptoms. Only in the angle closure glaucoma, you may have headaches, you may see colored halos, and in severe cases, you may have sudden redness of the eye with a lot of pain and blurred vision, and that could be also associated with vomiting. Now, for us as Asians, we need to know a little more about this angle closure variety because quite commonly, this is associated with a headache which comes on at the onset of little less light or probably in a little darkness. So supposing you are in a theater in the dark and you get a headache every time you are in the dark, or you get a headache every evening at dusk time, that is a time when your pupil becomes a little big in size to accommodate more light to get into your eye, and the very fact that your pupil is getting a little larger than normal causes the angle to close down and does not allow the flow of aqueous easily. And that could be one sign of an early sign of an angle closure glaucoma. So if you have that kind of a headache, don't just take it for granted and go on taking popping pills for a headache, but get your eyes examined. How do I know that I have glaucoma? If you have any of these other risk factors that I have mentioned above, please get your eyes examined. Now, the onus of diagnosing glaucoma is on the ophthalmologist because there are no symptoms. So, unless you have got your eyes examined regularly, you will never know that you have glaucoma. Now, like I told you, that if you get a headache in low light, example in a theater or at dusk, do seek an opinion. And getting a regular eye examination after the age of 40 will ensure that the disease will be detected early. What tests are done to detect the glaucoma? Very, very simple. It's just a simple comprehensive eye examination, which means a detailed eye examination, including the intraocular pressure, the angle of the eye, which is done with a small little lens, which is known as a gonioscope. The optic nerve head is seen through the slit lamp with another lens. And then, if you think that there is a suspicion of glaucoma with these three exams, what we do is go ahead and do a functional test, which is known as the perimetry, wherein we are able to assess how much visual field is actually affected. We look at the corneal thickness because we know that people with thinner corneas progress more rapidly than people with thicker corneas. And then there is a structural test, which is known as the OCT, which helps us to find out how much is the damage actually without doing a histopathological section of the eye. So you actually, we can get a slice like you get in an MRI or a CT of the eye, which could be as thin as 2 microns, and we could therefore tell what is the difference in the eye that is happening because of glaucoma. Why is it a must to get an early diagnosis? We know that we have born with 2.5 million retinal ganglion cells, but these cells normally die at the rate of 5,000 cells per year from the time that you are born. In glaucoma, this rate is accelerated. So at least 40% of the cells are lost before a visual field defect can actually be detected. That is how early a diagnosis is made. That means unless you lose 40% of your cells, we can't even say that you have glaucoma. And therefore, to preserve all the vision we can, because we already lost 40% by the time a diagnosis is made, we need to make an early diagnosis. Unless you make an early diagnosis, we will not be able to help you very much. Is glaucoma curable? Like I've stated, glaucoma cannot be cured. But the treatment is to try and prevent progression and retain all the vision that we can. The aim is to let vision outlive the patient. How do you treat glaucoma? There are multiple means of treating glaucoma. So we have a lot of medications that are available. We have a laser that we can apply on the eye and prevent further loss. And of course, if nothing works, then we always can resort to a surgery. And there are various surgeries that are done, of which trabeculectomy is the gold standard. In the medications, we have a lot of medications that we use to actually reduce the intraocular pressure to a level where no further damage ensues. Drugs can reduce the aqueous humor production. So if there is less aqueous to drain out, obviously your pressure will be less. Then there are drugs that increase its outflow. That means if there is a barrier somewhere to the flow of aqueous out of the eye, then these drugs will help to push this aqueous out of the eye more than it normally does. And then there is a third group of drugs which may actually protect the retinal ganglion cells from injury. So we know that there are precipitating factors which are causing injury to the retinal ganglion cells, but we have drugs which will help these survive these insults, and therefore they will not get injured and they will not die. So the aim of treatment is to preserve vision by reducing the intraocular pressure with minimum side effects, maintaining the quality of life, and at an affordable cost. This is what an ideal glaucoma drug should be doing. And there are also lasers that can be used in treating glaucoma. So in an angle closure disease, a small hole is made with the help of a laser to create a small pathway for the aqueous that is blocked behind. And therefore it allows the aqueous to flow out, and therefore it does not allow the aqueous to build up and cause a rise in the intraocular pressure. In the open angle variety, there is another laser that we use, which is known as the selective laser trabeculoplasty, wherein this laser acts on the sclerosed trabecular meshwork and it opens out this meshwork which is sclerosed because of age. However, since the sclerosing process is an ongoing process because it is age related, this is not a long lasting treatment, but we might have to repeat this laser once the effect wears off. But it could last for as long as 18 months to 3 years on an average. And congenital glaucomas, the only form of treatment, however, is surgery, because in congenital glaucoma, what goes wrong is abnormally the pathway is not formed correctly. So we have to create this pathway. When they are born with an anatomical defect, and this anatomical defect needs to be corrected surgically. So there is no other form of treatment in congenital glaucoma but surgery. And in the adults, when maximum medical therapy does not give you the desired result, then of course surgery has to be resorted to. So when a patient is diagnosed with glaucoma, what are the changes he needs to make in his life? There are a few things that he has to understand, and he does not have to get depressed. One, he has to use his medication as prescribed by the physician. He must see his physician regularly and discuss all his medications, be they ocular or systemic, because without their knowing it, they could be using some systemic medications which actually give rise to a increase in the intraocular pressure. And if the physician knows what medications you are on, he can titrate the dose of the medications that he's going to prescribe to you in a much better way. Also, when the diagnosis was made, you probably had a status X. Whereas, as you're going about the disease, say you were diagnosed at the age of 45, and at 55, diabetes has set in. At 60, blood pressure has also set in. So now whatever medications were good enough at the age of 45 and between maybe 45 to 50 are no longer good enough just now. So he might have to change your medications or change the way he is treating you. And therefore, it's very, very important for you to discuss your entire medical status with your physician every time you visit him, because he has to adjust to the limited fields. He has to see how you're progressing. Is your disease stable? Is it progressing anymore? Does he need to revise his treatment? And if so, he will do it in good time. And remember that his aim is to give you the best vision that he can, so that your functional vision will definitely outlive you. Now, what does a patient have to also do? He might have to adjust to the limited visual fields and the poor contrast that might result because of glaucoma. What happens is with glaucoma, like I showed you in that earlier picture, when your peripheral fields start losing, say you're walking on the road, somebody who walks past you from the side, you might not see him and you might bump into him. So you have to be very alert when you're walking by yourself, especially when you're walking in the dark or in dusk, because your contrast is slowly reducing and you can't see as well in the dark as you can in the day. So as far as possible, if your disease is quite progressed, I would suggest you should not go out on your own, especially in the evenings at dusk time, or very early in dawn. You can move around during the day, but during the evenings when the light is poor, it's always good to take assistance when you're going out. Uh, Otherwise, he can continue to do all that he's doing. He wants to pursue a hobby, fair enough. Go ahead and do it. You want to, you want to work, you can go ahead and work. You want to watch TV, you want to read, you can do whatever else you're doing and whatever you can do. But if you have any new symptoms or signs, then it is very, very important to report back to your doctor. The most important thing that a patient actually needs to do is to be very, very compliant. Now, this is a very easy thing to say and a very difficult thing to do. Some years ago, I had done a study on compliance, and I found out that there were hundreds of reasons why patients don't use their medication as prescribed. The most common causes, they say they've forgotten. There are many, many other simple causes, that can be easily looked after, because the time of installation of medicine, if it is tagged together with some other activity of their life which they will 100% do. So say for instance, they will have their breakfast, they will have their meals, they will go to bed. So if you time the medication alongside this, it is more likely that they will use the medication than they will not. The other thing to find out is, are they having side effects which they are not at all liking and they don't want to talk about it? So, there are certain medications that give you a lot of stinging of the medication in the eye. So please tell them to instill that bottle in the fridge. So a cold medication will sting you a little less than a normal temperature blood medication. The other thing to do is, they have a lot of growing of eyelashes. The eyelashes grow really long and they don't like it. Or there is periorbital pigmentation that happens. So their eyes and the skin around their eyes becomes dark in color, and cosmetically they don't look good. And nobody likes to look bad at all. May it be a young girl or may it be an old man. Whatever it is, everybody is very, very conscious of their looks. So the thing that you can do is, there are these prostaglandin analogs which do tend to cause a lot of periorbital pigmentation. So what you need to do is, you need to tell them to apply a little cream around their eyes before they instill the drops, so that the medication per se does not touch the skin. Another thing that you can do is ask them to use a tissue and press on the medial side of the eye, so that the excess of medication does not spill over onto their skin and you get much lesser pigmentation. There are lots of people who also complain of redness of eyes. Now, that is something that you have to explain to your patients, and you have to tell them that you have to trade something for something better. So, if you want to keep your vision, and if these medications are working excellently, except for the fact that they're causing red eyes, then you have to just learn to accept that you have red eyes and, go on with it. So, to summarize, please be aware of glaucoma. If you are at risk, please get your eyes examined regularly. If you've been already diagnosed to have glaucoma, take your medications regularly, follow up with your doctor regularly. And because we know that there is an element of heredity to this disease, please let all your relatives know about this and ask most of all of your relatives to get their eyes examined, because the earlier the disease is diagnosed, the lesser will be the blindness that ensues because of this disease. To do us a favor, as we are explaining awareness to you, I would also request all of you who are listening to spread awareness amongst your friends, your colleagues, and your relatives, and help prevent blindness from glaucoma, because the glaucoma that ensues is irreversible. So you can get blind because of cataract, but that is a completely reversible form of blindness. You may not see so well because you have refractive errors, which can be easily corrected with glasses. But once you have glaucoma and you have lost vision because of it, the lost vision can never, never be regained. So please take this a little more seriously, give it a little more concern. And as we are helping spread awareness of glaucoma, we would like each one of you to also talk to 4 or 5 other people whom you know, and just imagine the amount of awareness that can be created by just a mouth of your. Thank you very much.